The clavipectoral fascia. First, the deep fascia of the pectoral region. It is a thin fibrous membrane which is devoid of fat and continues superiorly above the clavicle with the deep fascia of the neck, medially in front of the sternum to the opposite side fascia. Supralaterally, it is continuous with the deltoid fascia. Infralaterally, it continues with the axillary fascia, and inferiorly, it continues with the thoracic fascia. It covers and binds all deeper structure in the pectoral region. It consists of two layers or lamellae, the superficial one which covers pectoralis major and the deeper one which covers the pectoralis minor, and this deeper layer extends as above the pectoralis minor as the clavipectoral fascia and below the pectoralis minor as the suspensory ligament of axilla. Clavipectoral fascia is the deep lamella of pectoral fascia which lies between clavicle and pectoralis minor. In its upper part, it splits to enclose the subclavius muscle. The anterior lamina of clavipectoral fascia is attached to the clavicle, whereas the posterior lamina continues with the investing layer of deep cervical fascia above the clavicle, and below it merges with the axillary sheath which lies behind it. The upper thick part of clavipectoral fascia which lie along the lower border of the subclavius and extends from first rib near costochondral junction to coracoid process is named as costocoracoid ligament. In its lower part, the clavipectoral fascia splits to cover the pectoralis minor, whereas down below it continues as suspensory ligament of the axilla and is attached to the axillary fascia. In this way, it maintains the concavity of the floor of the axilla. Clavipectoral fascia medially blends with the periosteum of upper two ribs, costoclavicular ligament, and fascia covering external intercostal muscles of the upper two intercostal spaces. Laterally, it is attached to the coracoid process and blends with the coracoclavicular ligament. Notable aspect of the diagram is the relative position of clavipectoral fascia, pectoralis minor, and suspensory ligament of the axilla. As regard the clinical relevance of the clavipectoral fascia, collection of pus behind the pectoralis minor or in the neck can travel either way through the cervicoaxillary canal. Hence, this canal is considered to be gate of entry or exit for the pus. Sometimes collection of pus between pectoralis major and minor do occur, but it is very rare, hence is not important. The clavipectoral fascia is pierced by lateral pectoral nerve. Number two, thoracoacromial artery, which divides into its four branches. Number three, lymphatics of the breast to the axillary lymph nodes. And number four, cephalic vein, which opens into the axillary vein. Notable aspect is that first two structure of the above four pass outward, whereas the last two structures pass inward.